You're most welcome to this talk. Now, yesterday we did an interview on Deutsche Welle television, and quite a few of you noticed the injection technique which was being used. Let's take the three examples that there were on that interview yesterday that we did with Deutsche Welle TV. Now, here we go. So we see the needle going in, no aspiration, and the plunger going straight in. In slow motion, needle goes in, no aspiration. There's the needle fully in, and then the thumb goes down, injects straight away. No aspiration. Again, in and straight in without aspirating. Again, in and straight in. Let's just see that one again. So we go in, no aspiration at all, and we inject straight away without hesitation. Now that's what I would call in doing it blindly. You can't see where the needle's going. Now let me just show you what I mean on this this illustration we've got here. So this is the situation here. So here's the bone, that would be the humerus, where the injection, top of the humerus where the injection goes. So that's the skin here, then the muscle, then bone, and there could be a blood vessel you see in here. So if the syringe goes into there like that, then that's okay because it's in a muscle and you can inject, and that's absolutely perfect, straight into the muscle. But if by chance you inject and you can't see this, it ends up in a blood vessel, then you could end up giving the injection directly into the bloodstream when it would just pass around the whole body. So that's what we need to avoid. And of course I will be giving full evidence for everything I'm saying in the description below. Now let's have a look at an example from China where this was done much better. That's actually one from the States where they didn't aspirate. So this one's from China. In we go. Draw back, see that? Draw back and then inject. So nicely done, nurse from China. You know you're not in a blood vessel because you've drawn back first of all. Whereas that one from the States, they just went straight in. So nice and slow motion from China, so we've got it. So in we go, and we're going to draw back, make sure we're not in a blood vessel. If there's no blood, then we carry on with the injection. So nicely done from China. Now I want to give you an experience now of Jim from Taiwan. And this is Jim's experience. Let's just say it's very positive, and it's evidence that is really important, and I'll be telling you why what Jim says here is so absolutely vital. And let's just go straight on to it. Jim, thank you very much for this report. Jim in Taiwan.
Hello, my name's Jim. I live in Taiwan. Yesterday I got my first shot of the local Taiwanese vaccine called Medigen. My Mandarin is not great, so I had Dr. Campbell's video showing how to aspirate a needle ready with me at the hospital. And I learned, I thought, how to say in Mandarin, please aspirate the needle. But apparently I was wrong because the staff person who was there ready to inject me didn't understand what I was saying. There was some miscommunication. So she went to get a nurse who spoke English. And when I explained to the nurse what I wanted, she said, oh, the staff person had thought that you were saying that you wanted her to push out and pull out and push in the plunger several times, because we always aspirate the needle anyway. It's normal, because if we don't, she actually said, because if we don't, it's dangerous. We might hit a vein, and the injection could go directly into the vein when we want it to go into just the muscle. I said, okay, that's great. And then I watched them as they injected me and aspirated the needle. I thought, I asked them if they had ever had any injection where they aspirated the needle and they did see some blood in the needle, and they said yes. They said, they indicated several times. They didn't give a precise number. I asked them 1 in 100, 1 in 500, or they just said, they said it's not common at all, but but several times. So I thought it would be interesting to access and take a look at the Taiwan VAERS report, the Vaccine Adverse Event Reporting System. They call it the same thing in Taiwan. So I went online and I tried to access it. I couldn't. It's not publicly available. You have to fill out a form, make a special request. I'm a writer, so I plan to do that. We'll see what happens. I thought it would be interesting to compare the rate of adverse events in a country that aspirates needles for the COVID vaccines with a country like the USA or the UK that doesn't. So I'll see where that goes. And I had a thought that it might be that the reason why young men tend to have higher severe adverse events after reactions after these vaccines, like say Kyle the mountain biker who Dr. Campbell interviewed in a previous podcast, is because they may have larger deltoids and therefore even larger veins in their deltoids. So, you know, this could put them at greater risk of receiving the injection into a vein when the needle is not aspirated. So that's all. Those are my that's my experience. Those are my thoughts. Thanks. Hello, my name's Jim.
Excellent,
I live
excellent.
in Taiwan.
Thank you so much for that. Where am I? There I am, and the sound's back. Excellent. Now, I'm sure Jim's Mandarin is better than he's modestly saying there. The nurse there said they always aspirate. It is dangerous not to. So is this nurse in Taiwan wrong? In my view, no, she's not. Dangerous not to. She then used the correct technique on Jim, which of course I'm delighted about. They have seen blood several times. In other words, they've stuck the needle in, drawn back, and when they draw back, they have actually seen blood because they've been in a vein. Now, let me just show you. Well, I've shown you this before, but we'll just have a quick demonstration again. So if we go into the muscle and you draw back, then there'll be no blood goes into the syringe. That's fine. And then you can inject. But if you end up in a blood vessel by mistake and then you draw back, let me just show you what will happen, because remember that's full of blood and we don't want it to go into the circulation. So what will happen is if you're in a source of blood like that and you draw back, then you will immediately see the blood coming into the syringe and you know not to inject. That's what we mean by aspiration. So if you stick the needle in and you don't draw back, you're blind. You don't know whether you're in a muscle or you don't know whether you're in a vessel. You simply don't know. And the nurses in Taiwan seem to be well aware of this simple anatomical fact. Now, they've seen blood several times. Now, it's not common, but there again, these pericarditis and thrombocytopenia aren't common either. But if the injection is given intravascularly, it is my belief, and the evidence I'm going to give you below, is that increases the risk. So why aren't we doing it properly? Please do get that data, Jim. I would love to see that. I'm hoping to get some data from Denmark soon. I'm in contacting a professor in Denmark to try and get data because, of course, in Denmark they are aspirating. If you can get that data, Jim, from Taiwan, we can do a comparison. That would be brilliant. Jim is quite right. If you work out a lot, your deltoid muscles are going to get bigger. The muscles, of course, use a lot of oxygen. They use a lot of glucose. They produce a lot of carbon dioxide. They have to get rid of the waste products. So what do you think happens? The blood vessels grow in size as well. This is not really complicated neurosurgery. This is very basic anatomy. And as well as that, in young men that are particularly prone to pericarditis or young women that are particularly prone to thrombocytopenia, thrombosis, after the adenovirus vector vaccines, there could be other factors as well, such as, I suspect, hormonal factors. Now, Jim also sent me a link to a video from Taiwan, so let's play that now. In, draw back, and then inject. What is so hard about that? Nothing at all. So in they go. Draw back, Make sure there's no blood, and you can see the needle's nicely stabilized on the patient's arm as well. So it's not jiggling about. This idea that it hurts more than the needle jiggles about is just bad technique. That needle is perfectly stable because the injector's arm is stabilizing the syringe against the patient's skin, which is the 100% correct way to do it. Perfectly stabilized needle with the fingers while the other hand draws back. And if you look while she's doing that, because that hand is stabilizing it, there's no waggling around of the needle. Beautiful technique, absolutely perfect, exactly the same way I would do it myself. So excellent, and congratulations to that clinician and indeed that patient who got it done perfectly correctly. Just another example here. This one actually is from England. In we go, draw back and then inject. Let's just see that again. So drawing up, in, stabilising. Can you see the way her fingers are balanced against the patient's arm there like that? That's the correct way to do it. Leaves the other hand free for the aspiration and then is able to inject. So congratulations, nurse from England, for doing that the correct way. That's exactly how I've been teaching student nurses to do it for many years, for decades in fact. Now, let's get an experience now from Christopher. And to tell you the truth, I think Christopher's experience was fairly good, but I can't quite remember. So let's just watch Christopher's experience, listen to Christopher's experience now. Thank you, Christopher.
Hi, Dr. Campbell. My name is Chris. Currently in California, Los Angeles, United States. And it's October 31st. I love your channel. It's very informative, and I feel like it's a really great scientific and unbiased view of crazy times we're having. But I wanted to share one of my experiences. I work in the film industry. We are very, very, very concerned about the coronavirus, and we take it very seriously. We have pretty strict protocols that we go by. And so we're continuously tested, and they're having some mandates for vaccines. So I am fully vaccinated, and about 4 days ago, I received my booster shot. I wanted to be smart about this, and again, I've listened to a lot of what you've said, and I've did a lot of research myself. I also went to my doctor because I originally got the Johnson & Johnson one shot back in March, and I was trying to figure out if I should get a different booster, a different one, or if I should get a J&J. So after going to my doctor and speaking to him, he had stated that there were studies being done, which I know some that we've talked about here, and one of those was that if you have had a Johnson & Johnson shot, then you can mix and match, and you should. And his recommendation was Moderna. So last Wednesday, I scheduled an appointment. I could not get one through my doctor's office because of they didn't have the recommendation yet from their offices, even though it was you were able to do it other places. So I went to my local CVS, and I made an appointment. I went in there, showed them my vaccination card, and got prepped for the shot. When the pharmacist, or I guess pharmacist or nurse, came out to give me the shot, I asked them as respectfully as possible, and I said, look, I hope you don't mind, but I'd like you to administer it in a certain way. And they're like, what do you mean? And I said, would you do me a favor to aspirate the needle before you inject the vaccine? And I said, and hopefully you understand why I'm saying this. And this particular person, this pharmacist or nurse, knew exactly what I was talking about, and stated that they would totally do that for me without any problem. And so they administered the vaccine. He pulled back the plunger. There was no blood. And then he injected the vaccination. And it was a great experience. There was no confusion. And that was it. Now, the First day I didn't feel anything, but the following days I had a pretty robust response, and I'm just kind of getting back on my feet now. It's Sunday, so I pretty much just had sore arm, swollen lymph nodes, headache. I felt like I had a fever, but I don't think I actually had one. I never really went up past 99.6, and but I'm feeling really happy that I did it and that I got the Moderna shot, and looking for the future. So again, I just want to give you that experience. Again, it's a really positive one, and I'm glad I had a positive one. My son is 10, and I will be vaccinating him as soon as they approve it, hopefully next week. And we'll be doing the same process with where I go. So thanks again for all the information and all the positive information and just everything out there. You've been very helpful. So thanks again, and we'll talk soon.
Thanks for that, Chris. Excellent. Glad to see you had a positive experience. That is brilliant. So booster after the Johnson & Johnson, of course, because we know that the protection against infection wanes with the Johnson & Johnson. Your doctor recommended Moderna. That's why we have doctors to make recommendations. The pharmacist or whoever was giving the vaccine there knew what aspiration meant. So many people simply don't know what it means. I was just saying, I talked to a registered nurse the other day who went to a particular high street pharmacy in the UK, equivalent of CVS, I guess. Asked the pharmacist to aspirate, and they said, does that mean you inject some water before you squirt it in? Good grief, dearie me. People doing injections who don't know about injections. Now, okay, you did have some adverse effects there, the sore arm, feeling ropey, headache. These things happen, but you seem to be feeling better now, so I'm pleased about that. And of course, now your level of protection will be pretty high, which of course is good news. So thank you for that, Chris, and thank you for Jim for sending that in as well. So thanks to Jim and Chris. Really appreciate your experiences, both positive in this case, and both know you had an intramuscular injection, not an intravascular injection. So because your clinicians drew back, they knew they were not in a vein. They drew back, didn't see blood, so then they could inject, knowing it's going into the muscle, like that, where it will stay in the muscle for a period of time. The vaccine will go into the muscle cells. The muscle cells will make the antigen, and that will generate the immune response, rather than going into the vein directly, where it will circulate immediately all around the body because it's inside a blood vessel. So there we go. Lots of evidence posted below. Thank you for watching.